Literally 5.5, 6 months later, she was pregnant for the first time in her whole life after 19 years of trying and multiple failed IVF cycles. This is why I don't talk about supplements, because it's ridiculous as far as I'm concerned. It's a disservice. Right now within you already have 50% of that little baby that you want to create, whether it's in the form of sperm or whether it's in the form of an egg that's maturing.
Hey everyone, Derek Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. All right, my friends, you are in for a treat. So this podcast is with the brilliant Gabriela Rosa, and Gabriela is the author of Fertility Breakthrough, a really good book about kind of why we are seeing increase for infertility, what to do about it, and how do we think about that. A lot of the stuff we talk about is like what to do if somebody has gotten to infertility. What changes do they need to start making? What do we think about as practitioners as we drill down to find the actual problem that's causing that? What should people do if they've failed IVF treatments and everything in between that? I really like this conversation because the way we think about healing the body and healing pain problems, Gabriela thinks about fertility. So lots of parallels there in terms of like, how do we think about these things? And the big part that I took away from this is that there is almost always still hope. As long as we're hitting like the 4 things that allow us to reproduce, then there's still hope if we can make the right changes in our body. So if you know somebody who has dealt with fertility or is starting to think about that area of their life, if they're getting a little bit up in age, we talk a lot about like what starts to happen and what things mentally need to change if we start to be on a time clock, and we're starting to kind of go through some of that stuff. So I actually loved this podcast. This was a really great conversation, and I think there's a lot to pull out of it that you can kind of start to implement, and then kind of give yourself a new way of thinking about some of this. And, you know, do we want to find extra help for that? So we talk a lot about when should you find help and when do you need someone to step in and kind of help you work through these issues. So please enjoy this amazing conversation with Gabriela Rosa. Gabriela Rosa, welcome to the Pain and Performance Podcast.
Thank you for having me, Derek. Lovely to be here.
So we were talking before, so everybody will know really quickly, but tell us where you're from. Tell us your main kind of background in this.
Yeah, sure. So actually, I was born in Brazil, if we want to go all the way back there, you know, but when I was in my teen years, my parents immigrated to Australia. So majority of my life and education has been in Sydney, Australia, and in the US, actually. So I've done a couple of degrees at Harvard. So I've been in Boston for the last few years.
When did you start to focus on fertility? Was there a point where you were like, I'm going to dedicate some serious lifetime to this?
Yeah, it's a great question, and it was actually before I even graduated from my initial training, which was as a naturopathic doctor. And I knew pretty quickly that I wanted to specialize. I have this kind of personality. I like to master things, you know, and so I knew very quickly that even before I graduated, I didn't know what I wanted to specialize in, but I knew that I wanted to be the best in the world in something. And that was my kind of thinking before I graduated, and I was looking for what I was going to devote my life and my career to. And one day I was walking to clinic, as we do, you know, hundreds and hundreds of clinic hours to be able to graduate. And I saw this little poster that said natural fertility. I'm like, yep, that's the one. Fertility it is. So it was really that kind of amount of thinking that went into this. Of course, I had a couple of conversations that guided me in my thinking around what not to do first, because I was going to actually do pediatrics as a specialty. And I thought, this is a great idea because I love babies. And my boss at the time, who was an obstetrician gynecologist, literally looked at me. He was the loveliest, most, you know, like considerate and kind person. Turns around to me like, without missing a beat and says, Gabriela, that is the worst idea you've ever had. I'm like, okay. Usually so encouraging, Scottish man. And this day he's like, nope, that's absolutely a terrible idea. And I'm like, oh, tell me about that. Tell me a little bit more, And he said, well, first of all, your patients are not your patients. They're the parent of your patients, and your patients can't speak if you do pediatrics. So that's a bad idea. And I was like, you have a very good, valid point, and therefore my new mode of thinking was, okay, well, if it's not that, what else is it? Because I knew that I really liked the idea of babies and the idea of, families, and the idea of kind of really seeing something grow from nothing to something amazing, And so when I saw that poster, it was like, yeah, that I can see myself, really devoting my life to that kind of work. And that was exactly what I did. So literally when I graduated, I said, this is what I do. I specialize in treatment of fertility and helping couples, improve their health to be as healthy as possible. And of course, that transitioned entirely about halfway through my, kind of, let's say about 10 years into what I was doing. I've been doing this now since 2001, so I'll let you count the number of years, but basically it's been many years. And when I was about 10 years into it, I had a couple of really interesting cases where people were coming to me with like 10 years and 19 years of infertility. And I'm like going, I don't know, I don't think I can help with this. But it turned out that not only, and these women were, pretty much at the end of their road. And they even said to me, look, if you don't treat me, I'm going to stop and I'm going to give up and I'm going to stop trying anyway. So I just want to be prepared to have the best possible IVF cycle that I can, or to know that I've given it my all and this is my last kind of hurrah. And what was interesting about these two situations and these two cases, they kind of were a couple of months apart. And the first one was the lady that had been trying for 10 years. And she was very compelling because I was actually literally, because she was referred to me. So I didn't feel like I could take somebody on who was referred to me and treat them as if I could actually help them, being that I didn't think I could, right? And so I was very honest and very open about it. And I said, look, I've never treated somebody with 10 years of infertility. I don't know that this is, whatever it is that I'm going to do is going to be enough, especially given that you've had multiple failed IVF cycles. And so, I don't know that this is going to be the thing. And she sold me on the idea of treating her, which was basically like, I'm going to give up anyway, so I just want to be healthier. And I'm like, well, if we look at it from that perspective, okay, fine, I'll help you do that because I know how to do that, And so that's essentially how the whole thing started. And of course, 3-4 months down the track of doing all of the kind of process and focus that I had been doing up to, for the last 10 years at that point, to get people as healthy as possible to have a healthy baby, she actually ended up conceiving naturally with her own eggs and, literally after 10 years of multiple failed treatments and nothing else having worked. So I thought it was a bit of a fluke at the time, I'll be honest. Like I literally thought like, okay, these coincidences happen. So nice that, it happened, but I don't think that this was because of what I did. And then when the second lady came in that had been trying for 19 years, at least I was a little bit more open to the idea of like, well, look, maybe you could do with being healthier and this person could really do with being healthier. So I was like, you know what, let's just focus on that and see what happens from there. And literally 5.5, 6 months later, she was pregnant for the first time in her whole life after 19 years of trying and multiple failed IVF cycles. So at that point, I was like, okay, there's something here and I don't know exactly what it is and I can't really exactly pinpoint it, but I'm going to start kind of talking more and more with people who have been trying for 2 years or more. And the reason that I picked 2 years or more was because I recognized from all the patients that I had seen and also from having seen these two women, there is a thing that happens when somebody has been trying for 2 years or more compared to when they've been trying for a year and under 2 years. And it's really fascinating. And I really noticed this because I was kind of seeing a lot of struggle with getting people, before these two women, I used to see a lot of struggle and impatience and people kind of not really be willing to really do the work to be optimal in terms of their health before trying to get pregnant because they had this innate sense that they were running out of time, that they didn't have time to waste, that they just needed to go and do this thing. And what I noticed in treating these two women was that they were at the complete opposite end of that conversation in their mind. They were like, you know what? I don't give anything about time because I have been trying for 10 years or 19 years. And at the end of the day, like, I just want to actually close this chapter. I don't even want to, like, in fact, what was so fascinating about the second lady, I remember so clearly. She actually just wanted to get it done, over and done with. Like, she literally just was like, her husband actually made her come. She really didn't want this, like, she was kind of like, yeah, if I have to, like, fine, but I
check
don't,
the box
I don't,
and say I did
pretty
it.
much.
Yeah.
And I think that, exactly, I think it really was this kind of relational component of she didn't want to, for him to think for the rest of their life as a couple that she was the one who didn't want to do the last thing that he wanted to do about this. And she just wanted this thing to be over. Like, she literally was, that was her entire, not only her conversation, but her entire energy, her vibe, her everything. Like, to the point that to this day, she was probably one of the rudest people I ever treated in the beginning of a treatment, because she was like, she just really was not, she didn't care, she didn't want it. She was just like, doing this thing because he wanted it. Anyway, long story short, what was interesting and the kind of distinction that I noticed was like, these people were not in a rush. They just wanted to make sure that they did everything that they possibly could so that in their mind, in their conscience, they were like, you know what? Yes, when I'm sitting in my porch, when I'm 90 years of age, looking back at my life, I know that I have given my best, that I have done everything that I could. And if this did or did not happen, it wasn't because of something that I did or didn't do. And so I really noticed that. And so from that perspective, I went, you know what? This was the best experience I've had treating people with infertility ever, because I wasn't having to talk them off the ledge every single month that they weren't getting pregnant and thinking that, oh my God, my life is going to be over. This is a disaster. They already understood what it was like to be infertile for 10 years and to potentially never have a baby, so it wasn't such a big drama in their mind. And,
do you think that's important? Like that they had kind of, I want to say removed like the stress from it, but how important
resigned.
Is that part of it where they're like really like grinding and pushing for it? Is that important in this?
I think that, what I noticed, and that this is why I made this shift, was because I was tired of, having to have this conversation with people about, listen, you need to be focused and comprehensive about your tests and getting the proper diagnosis and understanding why these things are not working, rather than just continuing to hand money over fist and give more and more money to a failed process that continues to fail, and you continue to think that it's a numbers game and let's just keep trying, when it clearly is not, when clearly there are obstacles that are stopping you from getting pregnant and holding a healthy baby. And so finding out what those things are is more important than just going and rushing into another cycle because you think you're running out of time. I've had so many people since over the years come to me. I remember this one lady forever, her children, she updates me pretty much every holiday. I get photos of, Halloween costumes and, it's so beautiful. Birthdays and Mother's Days. And, I love it. I absolutely love it. But I remember her so clearly because when she first came to me, she said, she was under 40, but she had been told by 3 different doctors in 3 different clinics that she probably would never, that she needed a donor egg, but that donor egg probably wouldn't work because she had very thin lining and, it was unlikely that she was going to actually be able to keep a pregnancy to term. Therefore, she should really focus on getting a surrogate. Now, when you hear that and you're like 30 something, it sounds pretty extreme. But she didn't hear it once. She heard it 3 times, 3 different doctors, 3 different clinics, and she still was like, you know what? I don't know about this. Like, I don't think this is right. Like, there's something in me that tells me this is not right. So she reached out to me, and I did what I always do. I take a very comprehensive case so that I understand before we even start to work together, can I even help this situation? Like, that's one thing that I do every single time. I will not take on somebody who I don't think I can help. Or if there is a different way in which, from what they're thinking, that I can help, then I will tell them that in advance. Like, I don't, and this is part of why we have a 78.8% live birth rate. Because essentially, I know what kind of patients we can help and we can treat with success. And if they deviate from that, I have that conversation in advance. And, they only go into treatment if this is something that's going to be a high chance of yielding a baby. But anyway, so this lady, after this entire conversation, I said, look, I have assessed your situation. Yes, there is work to be done. There are things that we need to improve, right? Yes, it is work we can do. And yes, we have done it before in a similar set of circumstances. And there is nothing in your case that I look at and I go, no, this is never going to happen. And my test for that is actually, I do a thinking exercise that's the opposite of what people actually imagine when they come to see a fertility specialist. I literally ask myself this. If this person came to me and said, it would destroy my life if I was to get pregnant and have a baby, do I need to use contraception? That's the frame I use, right? So I'm looking in a case to understand and figure out, does this person need to use contraception? Like, literally. Because if I find something that says to me, like, I have no ovaries, then I'm like, okay, this person does not need to use contraception ever, because ultimately they're never going to conceive unless they go through intervention to do so, which means that they don't need to use contraception. Now, if a patient passes that lens of, is there work to be done? Is there work we can do? Have we done it before? And do they need to use contraception? If those questions are answered with yes, 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 and no, or yes, then I know that, okay, this is something that we really need to work further in understanding, because there is something here that's obviously an obstacle that we can optimize.
When
so with this lady that
go ahead.
No, so I was just going to say, so with this lady that came to me, and, after I had that conversation and that assessment, and I said, look, I think that this is something we can do. Long story short, despite being told by 3 different doctors, 3 different clinics, that she would never have her own babies, she conceived naturally with her own eggs, not just once, but she was also able to give a sibling to her child. And now she has 2 beautiful, healthy children, a boy and a girl. And so, it's, to me, it's the fact is that you do have to give yourself the chance, the opportunity to really unravel what's getting in the way. And that's what a lot of people under the 2-year mark feel desperate about doing, because they want this outcome so much that they don't want to actually spend the time to do the right work. They think that taking a shortcut is going to get them there. But when the multiple failed IVF cycles happen and they're scratching their head going, okay, I've done 5 cycles and nothing has actually worked, and now I don't know what else to do, or they've done donor egg and it still has failed, and they were told that that was the thing that was going to work, then they're like more open to, right, let me do the work properly, because clearly nothing else is actually doing, what needs to be done.
Yeah, I like that. Trying to get to the quick fix probably seems to add a lot of layers that make things more challenging. When we're seeing people who are dealing with infertility issues, I assume a lot of them have diagnosis that are already there through modern medical testing. What's your thoughts on those? Like, what would be common ones that somebody would come to you with, and let's break those down to maybe what do they actually mean?
Yeah. So unfortunately, infertility is one of those conditions, and it's probably one of the only conditions that the diagnosis is fully self-reported by the patient. by a measure of time of trying to get pregnant. Okay. Meaning that you can be diagnosed with infertility because you have, in a period of 12 months, had 1 or 12 conception attempts and have not gotten pregnant. So at that point, you will literally go to your doctor and say, I have been trying for 12 months to get pregnant and I'm still not pregnant. At which point, that doctor is going to diagnose you with infertility. No tests are required to diagnose a couple with infertility. It's literally that's the diagnosis. Okay. Now, that is problematic because of many, many, many reasons. And part of those reasons is that when a couple finally gets past that 12-month mark and they go and see a doctor, there's only really 4 things that need to be done to be able to understand if there is a quote unquote problem. The fact is, if you're trying to get pregnant and you're not holding your baby, that's a problem. Okay. But if you go and you go and do your fallopian tubes being checked to see if they're clear, and checking to see if a woman is ovulating, checking to see if she has a uterus and if it looks normal, right? And then finally checking to see if there is sperm. Those are the 4 things that need to be done. And sometimes only the first 3 are done. And couples are told everything is normal. Okay, what about the semen analysis? It's okay. Like, this happens around the world. I treat patients in every continent other than Antarctica. And I have seen people who literally have had a 5-year of trying to get pregnant kind of time frame, and a man hasn't even done a semen analysis. And then I just kind of go like, what is this? Like, what is going on here? So the reality of it is that those 4 tests being done are not really going to tell us very much, other than, yes, you have a uterus. Yes, you have ovaries. Yes, fallopian tubes are clear. Okay. Now, that tells us about what is happening in terms of, like the actual anatomy.
Yeah,
but it doesn't tell us about function.
Anatomy. Right.
Precisely. So it doesn't tell us about function. It doesn't tell us about, what else could be getting in the way. What are some of the biochemical factors? What are the underlying issues? Are these cells actually meeting, and are they fertilizing? Are they creating an embryo? Is that embryo implanting? A lot of times when people have been infertile for 5 years, they have, and this also happens when they have had IVF cycles and they've had embryos and they've had embryo transfers. The reality is that if you've had an embryo transfer, okay, you were pregnant at the time of that transfer. If you did not see a positive pregnancy test, that does not mean you were not pregnant. You were pregnant, which means that if you had an embryo inside you for a 2-week period to the pregnancy test, and that pregnancy test is not positive, you've had a miscarriage or you've had an implantation failure, right? And so one of the things that happens very frequently is that couples, especially with long-standing infertility, they will conceive many, 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 many times, but they will actually lose that pregnancy before they're able to see a positive pregnancy test. So they misclassify miscarriage or implantation failure with infertility as well. So there's a whole bunch of issues that happens in, reproductive epidemiology, which is, we're assessing in the general population that this is what should be happening, or this is what's happening, when it's actually not really, and we don't really know, a lot of these different kinds of conversations. But the one problem that you've asked about, which is, what are the tests and what do they mean? One of the biggest issues that I see in terms of fertility is that the label of unexplained infertility is the number one diagnosis that people receive when they're trying to conceive, and it hasn't actually been straightforward. And they've had some of these tests and they come back as normal, quote unquote, normal. And I make a really big point about this because the only thing that is normal is you have sex, you get pregnant, and you have a baby. That is normal. Anything that deviates from that may be common, but it is not normal.
I love that.
Okay.
Very, very many questions came in on this, which was like, hey, here's my test results. These things are normal. What things are they missing? What are we not looking at? So I know there's quite a few tests. So typically if somebody comes into a fertility clinic, they're going to run some blood tests. They're going to kind of look at the anatomy. What are the blood tests that they often run?
So typically a woman will get things like her FSH, her LH, progesterone, estrogen, AMH. Those things are typically done as baseline on day 2 of the cycle. And then, of course, for a progesterone test post-ovulation, typically 7 days post-ovulation, if you have a lengthened cycle, it's not going to be day 21. It's going to be 7 days post-ovulation. If you don't track your cycle by using basal body temperature or some other means, you're not going to actually be able to account for that very well. So you might have the test and it might say you haven't ovulated or you're not ovulating. And that is because it just has missed the peak of progesterone because of it just being tested in the wrong day. So the thing about it is that those are kind of like the basic tests. And, most fertility clinics will also look at infections. So they will rule out major infections, your Hep B, C, HIV, any kind of syphilis, gonorrhea, like the major kind of sexually transmitted infections that you'd hope that you would know if you had them, anyway. But sometimes they're silent, sometimes you don't know. And so those things get ruled out. And especially with new partners, you obviously want to make sure that these things are all tested and that there's quarantining and repeating tests, 4 months later and so on and so forth, so that you really know, because silent infections can also be a real cause of infertility. The problem with that is that your basic testing that gets kind of to the bottom of, sexually transmitted infections doesn't really look at the underlying microbiome overgrowth / other bacterial microorganism infections that can impair implantation and, fertilization and so on. BV, bacterial vaginosis, is a really good example. Women who have a history of having BV, even when it's resolved, her partner is going to have BV-associated bacteria in the tract, in the penile tract, and therefore it's going to negatively impact. It can actually reach the prostate. It will, in many cases, negatively impact sperm quality. And that's even when a woman isn't having active BV, but has had a history of BV just from unprotected intercourse. So these are some of the things that are more underlying, in that conversation that often do not get checked. So when people say, I've had all the tests and everything is normal, they've had those 4 tests.
Right.
They've had kind of literally 4 things, and the doctor said, yeah, everything is normal. Well, they've only tested 4 things. So, it's fine that those things are normal, but what you really need to understand and what you really need to get to the bottom of when you are not holding your baby is what is not normal. Because that really is the place that you're going to get leverage, that you're going to get, where are the gaps, where are the places of opportunity, where you can actually change and really be able to actually transform results. Hearing that everything is normal when you've been trying for 2 years or more is useless. At best.
In our world, we see it. Somebody comes in and they're like, oh, my pain's normal, right? They said it's all normal. They looked at it and they're like, well, they looked at an image and they use that and, same thing, base blood tests and saying everything's normal. I equate that as the same. Well, you looked at, 2 or 3 things, but the results are still not normal. So we just haven't found it yet. In your situation, what would you test? Like, what would be the other things that we want to look at to find out, like, okay, where are we having some dysfunction here?
Yeah. And look, that's a really great question. And it's almost an impossible question to answer without having a patient in front of you with a history. And the reason is because, as you know, there's thousands of tests you could do. right?
Yeah.
And so from immunological to reproductive to hormonal to, like, gosh, there was so many different things. So one of the things that we do, and this is part of, we run a free program called the Fertility Challenge where people come in and get educated about these types of things. And the basic testing that we run is more comprehensive than most clinics would run on a kind of normal day. And the reason for that is that our focus really is helping couples overcome infertility and recurrent miscarriage when other treatments have failed and typically have been trying for many years. So my lens, it's almost like, if we look at the general population of the majority of people will get pregnant within that 12 months. In fact, the reality is that the majority of people will get pregnant within 3 attempts. So in the general population, you have sex, you get pregnant, you have a baby, done, we're no longer having this conversation. When we're still having this conversation, we go to that kind of other group of people who 12 months hasn't done it for, and then they're considered infertile. That's the first layer of fertility problems, because in that demographic of people, most people will have a couple of IVF cycles and they'll get pregnant. And then you have 70% of those people who will not. So only 30% of IVF cycles actually yield a pregnancy at the end of them, a baby. Okay.
That's a lower percentage than they make it sound like.
Yeah, precisely. So it fails 70% of the time, right? And so what happens, and to have a cumulative live birth rate of close to 80% through IVF, you need on average, and this is based on published data, you need on average 8 IVF cycles. Now, in the United States, an IVF cycle out of pocket is around $20,000. Sometimes it's somewhere between 15 and 20,000. Now, imagine if you need 8 of those.
Yeah.
Most people can't afford it.
And then you got to pay for a kid if it is successful.
Don't even get me started on that. That's the $1 million, up until the age of 21. So, but and this is actually, it's a funny thing you say that, because people often say, I can't afford fertility treatment. And I think, like, that's fair, but you probably also can't afford to have a baby. Right, because whatever you're going to pay for fertility treatment for the, kind of year before you bring them into the world is essentially what you're going to pay for them when they actually are here.
Yeah, yeah.
So money, yes, it's real, but and I think that part of it, like we're seeing population kind of fertility rates decline, partially because people are kind of like almost thinking, do I want this, responsibility of raising a child? There is a lot of that in our societal kind of, conversations these days. But anyway, that's a whole other story. We better park that. For those people who are still having or trying to have babies, the thing about testing is it's going to depend on many factors that are relevant to their case and medical history as well.
Yeah.
Right. So
what's y'all's base? Like, are you looking at, is this micronutrients? Is this food sensitivity? Like, what's the...
All of it. Yeah, so literally we're looking. So here's how I contextualize it for people, right? People say to me, so what do I need to do to improve my chances of having a baby? I look at it and I say, okay, the easiest way for me to put this into a picture that you can easily see and identify is this. If you are pregnant right now, what are all of the things that you would absolutely do or stop doing to bring home the healthiest possible baby, to gestate the healthiest possible baby? Would you want to look at making sure that the mother is not suffering from food sensitivities, that has a replete amount of nutrients in her system, that, is avoiding toxicants and, chemicals and things that essentially are going to be problematic in terms of health? All of that is yes. Right? Now, here's the thing. Let's step back from that, even one more kind of step back, and go, all right, so if we know that we need to do those things when a woman is pregnant, what is the thing that they need to do as a couple before a conception is even in place? And it's the same thing. Because right now within you already have 50% of that little baby that you want to create, whether it's in the form of sperm or whether it's in the form of an egg that's maturing. So that 50% of that baby is already there, which means that to optimize the chances of getting home a healthy baby and to optimize the chances of the egg and the sperm being as high quality as possible, you need to do all the things that you would do if you were pregnant right now. And men are included in that,
Yeah.
right? So it's almost like men have to kind of imagine what it would be like to be pregnant. I know we probably would even have a greater population decline, but the point here is that, that's the thing. So all the things that you would
Do people know that answer though?
I think most people do. If I was to say to you this, right? What are the things that you need to do to be as healthy as possible? Most people will point you in the right direction.
Yeah.
Have to have enough sleep, have to have good quality food, have to do some exercise, have to make sure that I'm avoiding things that are toxic for my body, right? Like, may sound basic, but it's like that is absolutely pointing in the right direction.
Yeah, for sure.
Right? And then we can basically go, okay, how do we refine that even further? How do we optimize that even more? And that's where then, perhaps some expertise comes in, perhaps some additional work comes in. But let me put it to you this way, right? I talked to a couple yesterday. They've had 3 miscarriages. They are both overweight and have insulin resistance, and they both smoke. And she's 40, and they've been trying for 3 years. So when I asked her, what do you think you need to do? If you were to kind of, give yourself some counseling here right this minute and tell me, what are some things that if you chose to, you could improve about your health, about what you do in your day-to-day, that would give you a better chance? She told me all of the things that she needed to do.
You're like,
so
right, go do them,
she
and we'll
knew.
talk in 6 months.
Yeah. So that pretty much is what happened. I said, so, okay, so you know what you need to do. And she goes, yeah, so now I just need to figure out a way of managing my stress so I can quit smoking. I'm like, well, yes, that's a really good place to start.
Yeah.
Right? So I didn't have to tell her what to do. She knew. I think sometimes people feel like they need the confirmation of what they already know.
Yeah.
And that's fine. But at the end of the day, people know what to do.
So if we move from like the testing stuff to kind of the refinement things, like, is there specific, when we start looking at diet, I've heard so many stories of patients coming in and saying like, I moved from this diet to the other. I could put the terms on it, whether they went from like, low carb or standard American to keto or any of these things. And they're like, within 6 months, I got pregnant. Are there specific diets that we know tend to prepare the body to carry a baby better? Or is this something that people have to like try and find the diet that just makes them the healthiest, which they hear all the time and they're like, well, that's what I'm trying to do.
Yeah.
But what's that look like for you?
Yeah, absolutely. And I think that's a really good question because, again, people try and complicate this way more than they really need to. If you base your meals on vegetables and good quality protein, you're there. Like, it does not have to be more complicated than that, right? So, and you want to use the rainbow. There is no white in the rainbow, right? So rainbow colors do not come in white. So that means that the things that are white on your plate probably should not be there. That's the first thing, right?
Okay.
And so basically, if you eat the rainbow as a very basic rule of thumb, and you base your meals on vegetables and protein is going to be essential. You need about the size and the thickness of the palm of your hand at each meal of protein. And protein, I mean good quality sources, from eggs to chicken breasts to chicken thighs to steak, not processed deli meats.
Yeah.
That is toxic. That is going to make you infertile. And there's lots of data on that, right? So we're talking about, I often say, and my kind of concept around this is the field to plate concept. That's the what I teach my patients, which is basically if you can recognize a food in the field on your plate, you're going down the right path. If that food has become so processed that you know it contains it as an ingredient, let's use corn, for example. You can see a cob of corn on your plate and know exactly what that looks like in the field. And you can see that in the field and know exactly what it will look like on your plate. That is one step from field to plate.
Yeah.
You want to keep foods no more than 3 steps from field to plate. So in the sense of corn, for example, by the time you actually cut the kernels and you serve that on your plate, that's 2 steps. By the time you cream that corn, that's 3 steps. And that's where you want to end it. Because by the time you've made polenta, tortilla, chips, this, that, like you've gone on the wild, crazy side of what is no longer acceptable for optimizing health and fertility. It might be tasty and you might want to use that as a 10% for the soul, the 2 meals in your week that you kind of go, okay, I feel like I'm going to have a burger today. And that's going to be okay. Like on Saturday night, like I might say, today feels like pizza day, know, and I delight in it and enjoy it. And, it's the thing that I look forward to, but it's my one meal in the week that I will have whatever it is that I want. The rest of the time, I'm going to make sure that I focus on vegetables and protein, eat the rainbow, 1 to 3 steps field to plate. Literally, I can recognize everything on my plate. I see it. I go, yep. I get from tomatoes to cucumber to whatever, I'm putting on my plate. That's the measure. It's like, do I recognize this food if I was to see it on the field?
I like that. That's a good way of explaining processed food. So let's drill down on this. So let's take the typical 38-year-old that's failed IVF. We're talking to them, hey, look, do the things you know to do. We're talking about diet. Let's go deeper. What's next? What else should that person be looking at? What do they need to bring into their life? What do they need to get out of their life?
So then in those cases, I'm then drilling really deep into diagnostics, right? Mm-hmm. So then I'm going to be looking at microbiome. I'm going to be looking at further testing in terms of hormones, nutrients, allergies, immunological components, what's happening with egg, sperm. I'm then really looking for biochemical dysfunction, okay? And I'm also looking for genetic SNPs, factors that can predispose certain, nutritional or other imbalances that are going to be affecting fertility. So then as a clinician, right, as opposed to, because I often say to people, lifestyle factors, diet, exercise, sleep, all of those things are critical and you need to do those things. Those things are what I call very important foundations upon which we can layer effective treatment. Okay. But they are not treatment on their own, even though sometimes, if you have a situation of let's say that we've got optimum health up here, above my head. If you can't see my hand, it's like I'm kind of standing up and I'm pointing above my head. Let's say that around my chest is where somebody is starting. Okay, they're starting from down here, which means that do they need to get to the point above my head to optimize their fertility? No, not necessarily, right? Would that be the absolute epitome of optimal and ideal? Yes. But most people will actually get a result, i.e. a healthy baby to term by getting to about my neck,
Gotcha.
In improvement. Yeah. And sometimes even less. So the thing about it is this, the amount where somebody is starting from is also going to dictate how much improvement you might need to change and transform a result. Let's say in the case of the lady who is overweight, insulin resistance, and both partners are smokers, quit smoking.
Yeah.
Even if we continue to not change body composition whatsoever, that one change might be enough to actually create the result that we want, which is a healthy pregnancy to term.
Yeah.
Is it the result? Is it the change that's needed to make it the absolute healthiest possible baby that this person can have? No. But will it be a very healthy baby and a pregnancy to term? Very likely.
So here's what that makes me think, and I guess correct this. So like, if you know, if you're in that group and you've failed fertility treatments, and you know there's things about you that are not healthy or as healthy as they could be, weight, diet, you're still eating a bunch of processed foods, maybe you're not exercising, your body composition,
you're drinking, you're smoking, you're doing drugs,
so change those things first before you would start to get to it. My question on top of that is, if someone's like, okay, I'm changing those things and I've failed IVF or I've failed fertility treatment, is this something that they can even sort through on their own? Because a lot of what you're saying is like things that you as an expert clinician are diving into. Like, is this something that they can even tweeze out of, like, oh, well, let me start taking this supplement and doing this?
Not exactly. And I'll tell you this, I have a lot of people that, in fact, it's so interesting. A lot of doctors, medical doctors, come to be treated in my clinic. And the reason for that is that typically they are very health aware. They understand what is not quite happening, and they understand what should be happening, right? Mm-hmm. The how to change it, they probably struggle or they have difficulty with, or they are truly in that place where they are already as healthy as they can be on their own.
Gotcha.
Okay. And I see a lot of people like this. Like, I see a lot of people who literally have the wellness regime down pat. Like, they would put me to shame. Okay. Mm-hmm. But in those cases, typically what happens is that it's the underlying gene SNP or biochemical dysfunction that hasn't been figured out that actually is stopping everything from working. So then in that kind of situation where you see, because the body can improve and adapt to a whole realm of things. Like, the person who is drinking, smoking, is unhealthy. By removing those things, they get such a huge leverage in terms of their health that it's almost, and actually I had the patient once, she was most upset. She literally was crying because she was this person, like, fully healthy, perfect lifestyle, routine, everything. And she literally got so angry, and in a burst of anger she said, maybe I should just shoot up heroin, maybe then I'd be pregnant. I'm like, okay, that's a different concept, but what? Like, and I was kind of like a newish clinician, this was that under the 10-year mark, and she said that, and I was like, okay, maybe that's not a good idea, but why do you say that? Yeah. And she goes, well, because, I see all of these women shooting up heroin and getting pregnant and having one baby after the other. And I'm like, oh, understood. Yeah, so here's the thing with that.
And they're still doing
precisely.
It. What's wrong with me?
Absolutely. So here's the thing, and this is epigenetics. Right? This is essentially, we've all heard of someone who has never smoked a day in their life and died of lung cancer. And we've heard of the people who basically have been chain smokers and have never developed cancer whatsoever. In fact, I have one of those uncles who, like, I don't even know how he still walks around, but he is healthy. Like, I just go, I'm sure he will die of a stroke or, a heart attack at some point, but he hasn't developed cancer. He has, so for the kind of uneducated, unquote, quote unquote, healthy, right? So here's why that happens. Same exposure has a differential impact on different people. So you can have exposure to cigarette smoking, and to one person, it will affect one organ system. To another person, it will affect another one entirely. So in the same way, this happens with fertility. So one person might be exposed to, let's say, I don't know, toluene from nail polish, right? Yeah. Basically, that person, because of a certain predisposition, a methylation issue, some kind of MTHFR SNP, whatever, right, basically has the effect of not being able to keep a pregnancy to term, so they keep miscarrying. Okay. Now, another person is exposed to tooling and pops out babies right, left, and center. They're usually the nail polish technician, like
Yeah.
doing the thing and polishing the nails and being exposed to that thing all day long. Now, does it mean that they're not going to develop cancer down the track? No, but they haven't been affected with infertility.
Yeah.
Where another person, just by having their nails painted, is being affected because they have some other underlying factor that's actually creating that differential impact. So this is where, in answer to your question, if somebody already has the perfect lifestyle, the quote unquote crunchy, to the max,
Yeah.
they're not going to be able to undo this on their own. Because
Yeah.
clearly what they don't know is what's playing a role here.
Right.
Whereas for somebody else, they may be able to do it on their own, because what it is that they need to change is obvious, and their body is actually set up that that's going to make all of the difference, in that situation.
You
So
talked about
my take on this, sorry, just to finalize, my take on this is this. If you're doing all the right things and you're still not holding your baby, it's because you haven't yet found what actually is the problem for you. And
Yeah.
that's the distinction.
You remind me of a lot of patients, and I've got a number of them that are like have had a child or two, and then lifestyle changes. Most of the time, it's for the health. Like they've done a lot of things to get healthy, and now they're having a lot of trouble for like that second child or third child. And one of the things that always comes up in those conversations is stress, and you talked about that a little bit. Let's tweeze out a little bit in terms of like stress and things that you've seen to be effective in changing stress on this level, because it seems like it's one of the hard parts for people to change in their lives whenever they're working on fertility.
Yeah. See, the thing about stress is that I have a love-hate relationship with this entire concept. Okay. And the reason that I do is because the way that I see it is like this. Yes, trauma, sustained, ongoing, long-term, stressful situations that are repeated or that are highly intense will affect fertility. There's lots of evidence that shows that that is the case. And on the other side of that coin, people get pregnant in war zones and have babies all the time, right? So the thing about that is that we need to again understand who are we dealing with and how it's affecting them specifically. That's going to be the key conversation and the conversation changer,
Yeah.
when we're dealing with stress. Because you see, in my doctoral thesis for my doctorate at Harvard is exactly about infertility related trauma, grief, and quality of life. Right. So it's an intervention focused on actually addressing that. So I have a lot of background in understanding, what happens in terms of stress and how it affects people. It also affects people differentially. And yes, do everything you can to be as zen as you can be. However, don't get caught up on the stress about stressing and how
Yeah.
that's making you infertile, because that is just going to drive you crazy. It's
Yeah.
not going to make you more or less fertile, but it's going to make you really unhappy and miserable.
I had a ton of questions about supplements, and I'm sure, like, how do you think about people using supplements in this? You talked about like the foundation. Make sure you check your foundation before anything. But if people are looking at using supplements in this world, what's the thoughts on that?
I have very unpopular
She's like, I could do a whole
opinions
podcast on this.
about this. I could do a whole podcast on that. In fact, as part of the fertility challenge, we have a whole hour me talking about supplements in particular.
Love it.
And one of the things that I will say about it is that you will not catch me if you like. I do a lot of patient interviews, podcast interviews, patient education, all of that. There is not one place anywhere that you are going to see me recommending or prescribing supplements, either what or what dose, to general population. It's just not going to happen. And the reason that it's not going to happen is because I fundamentally believe that when I have that conversation out of context, I actually do a disservice to people who have been infertile for a very long time. Because what happens is that I'm not helping them to get to the bottom of what's actually going on. I'm helping them to think that some band-aid solution is going to be applied solve a really complex problem that it is never going to do. So I believe it would be an absolute disservice to your audience and my patients for me to say, oh, yes, you should have XYZ, whatever supplements. Because the reality is that they probably should have, right? I mean, I'm not saying, and in my clinic, we prescribe all of the things, practitioner grade, pharmaceutical grade, herbal medicines, nutritional supplements, all of those things for very specific reasons in a very literally surgical way. It's like, okay, your biochemistry is telling me this based on your results, therefore you need, like, it's precision medicine.
Based on testing,
Based on testing. Yep. So should they be taking supplements? Probably. Should we be talking about it on a podcast? Absolutely not.
That's the big thing, I think, as well. The going joke, I mean, I talk about it in America, is that Americans have the most expensive pee in the world. We take tons of things just because, like, you hear it, but we don't know what our base level is. We don't know when we should stop. We don't know if we need to take more, what dose do we need to take? And if you're not getting a baseline, you're just throwing something at the wall and seeing if the result changes.
100%, Derek. And look, what I will also say is this: the beginning of my career, I actually was a technical expert in a supplement company that was practitioner grade, pharmaceutical grade only supplements. And I actually was involved in formulations and creating formulations of supplements for specific health conditions. And I remember once I was actually doing a prenatal kit that, essentially the way that I envisioned it was like, okay, there are some 4 basic things that everybody should be having, and they should be having these things in a certain amount and a certain dose in terms of the nutrients that they need per day. What was fascinating, and the first step that I did was identify what are the kind of products that are in the market and what are the ones that are best sellers, and listing in that every ingredient and nutrient within them so that I could actually see, okay, based on recommended daily doses and optimal ranges for therapeutic purpose, what was the discrepancy and the distinction between what was in that tablet versus how much you actually needed to have a therapeutic effect. Okay, so the most popular product in the market, which is from a pharmaceutical company, I won't name names, but the most popular basically it was a completely imbalanced formula that didn't have all of the core synergistic nutrients that you needed to be able to even process the things that they were actually giving to the person. And the dosages were completely skewed, like toxic range doses for certain nutrients and minute, irrelevant doses for other things. And so when I actually started doing this comparison and we finally arrived at the formulation that we were going to create for a product that was far superior, what we figured out is that the second most popular product in the market, in order to actually get a therapeutic dose for that product compared to what we had formulated, you needed 8 tablets of this popular supplement to get the therapeutic dose of 2 supplements, of 2 pills of the one that I had formulated. So, this is why I don't talk about supplements, because it's ridiculous as far as I'm concerned. It's a disservice.
That sums up how I feel about a lot of those things.
And it's not to say that it's not effective. The reason that I don't do a big thing about it and don't talk about it is because they can be highly effective, foundational for transforming results. But if you're taking the wrong thing, it's exactly what you said. You end up with expensive pee.
Right. Or in effect, something that should be effective and it's ineffective.
Exactly. And that's my biggest problem with the whole thing, because what happens is that these people, they can run out of time altogether to have a baby and realize a life's dream. Therefore, I don't think it's reasonable or fair or correct to basically be talking about masking a problem with taking a supplement as, instead of actually doing the work of figuring out what are the obstacles, what's wrong, and what do we need to do about it.
Yeah, I think that's so
Thinking that
powerful,
they're doing
especially
something,
right.
when they're actually not.
Yeah. You talked about the fertility challenge. Where can people find what's going on with that? How can they get information about you, about your clinic, about everything that you do? Where can people find all that?
So they can Google me, Gabriela Rosa, Gabriela Rosa, or they can go to my website, which is fertilitybreakthrough.com. So if they don't know how to spell that, just type it on Google. It will find me somehow. You will find me, trust me.
I highly recommend.
And also, actually, Derek, one thing that I forgot and that I will say, my book, Fertility Breakthrough, Overcoming Infertility and Recurrent Miscarriage When Other Treatments Have Failed, is available free on Spotify and YouTube. So the audio book, it's available on Amazon and everywhere else people buy books, but basically it's available free on those two platforms because I really believe in helping people to get the education they need so that they can transform their results. So the book is completely free on YouTube and Spotify anytime.
I highly recommend it too. One of the funny things was I almost didn't want to do child development whenever I was in school. And then once we started going through it, I was like, this is the most fascinating thing that I studied. And I don't use it at all in my daily practice, but I remember just being enamored with this insane process of how it happens. And I was like, people don't know how much of a miracle this is. This is incredible.
Yeah.
So I love that you're bringing that miracle to more people and helping them understand if they're having issues, where do we change these dials? Where do we make these little changes?
Yeah.
It doesn't matter. I know people are having kids later in life, but just because of that, there's still things we can do that make this a really great process and your body want to do it well. So I really appreciate what you're doing. I really do.
Thank you.
We ask all of our guests, if somebody, you're gonna love this question, you're gonna hate it, I'm just kidding. If somebody can do one thing listening to this to get a little bit healthier today, what would that one thing be?
Get pregnant now to get pregnant later. So literally, that is the one thing. It's a lot of things, but that's the one thing. And look, get enough sleep. Prioritize your life around getting enough sleep. That will solve a multitude of issues.
Love it. Gabriela, thank you so much. I appreciate it. Thank you. And I hope you have a wonderful day, my dear.
Thank you. You too.